The 3 itchy spots on elderly people indicate a shortened lifespan. If you don't have any of these, living to 100 is no problem. Health and longevity are pursuits for everyone. When it comes to longevity, our first thought is often about genetic inheritance. However, research has found that the biggest factor influencing longevity is people's lifestyle habits. Sometimes seemingly conspicuous characteristics may actually be signals of diseases that can affect lifespan. If an elderly person experiences itching in these areas after the age of 60, it's a warning from the heavens that their lifespan is short. It's crucial to pay attention. You may already know that the presence of itchy spots on elderly individuals can be a forewarning of a shortened lifespan. Take the case of John, a 65-year-old retired teacher who began experiencing persistent itching in his armpits. Initially, John dismissed it as a minor irritation, thinking it was just dry skin or an allergic reaction. However, the itching persisted and even intensified, despite his attempts to manage it with over-the-counter lotions and creams. John's daughter, concerned about his discomfort and weight loss, urged him to visit a doctor for a thorough examination. Upon visiting the hospital, John underwent a series of tests. The results were shocking. John was diagnosed with diabetes. The high blood sugar levels associated with diabetes had disrupted the function of his skin nerves and the autonomic nervous system, leading to decreased sweat and sebum secretion, dry skin, and itching. The diagnosis was a wake-up call for John, highlighting the importance of paying attention to persistent, unexplained itching. Health and longevity are universal aspirations, and it is crucial to understand the factors that influence them. When we think about longevity, our first thought often goes to genetic inheritance. However, research has shown that lifestyle habits play a more significant role in determining lifespan. Sometimes, seemingly innocuous characteristics may actually signal underlying diseases that can impact longevity. If an elderly person experiences itching in specific areas after the age of 60, it is a serious warning that should not be ignored. In another instance, Mrs. Smith, a 60-year-old woman, had been experiencing continuous itching since September. Initially, she didn't pay much attention to it, thinking it was just a seasonal issue. However, as winter approached, the itching worsened significantly. Despite using body lotion and ointments, the itching persisted, and she began to lose weight. Eventually, she decided to seek medical advice. Mrs. Smith's visit to the hospital revealed a surprising and alarming diagnosis: lymphoma. The itchy skin she had been experiencing for months was a symptom of this type of cancer. Lymphocytes, which are widely distributed throughout the body, can develop into lymphoma in any part of the body except for hair and nails. This case underscores the fact that itchy skin can be a sign of serious underlying conditions, such as cancer. Lymphoma occurs when malignant lymphocytes produce biologically active substances like histamine. These substances are carried to the skin through the bloodstream, constantly stimulating the sensory nerve endings in the skin, causing itching. About 20% of lymphoma patients experience varying degrees of skin itching symptoms. Therefore, persistent, unexplained itching that does not respond to treatment should be taken seriously and investigated further. Aside from lymphoma and diabetes, itchy skin can also be an indicator of other serious health issues. For example, persistent itching around the anus could be a symptom of anal or rectal diseases such as hemorrhoids, anal fistulas, rectal cancer, or anal cancer. Approximately 75% of patients with anal and rectal diseases experience anal itching, which initially starts as mild itching but can intensify and spread if left untreated. John's brother, a 70-year-old named Robert, began experiencing severe itching around his genital area. Initially, Robert thought it was a minor infection or irritation. However, when the itching persisted and began to affect his daily life, he decided to consult a doctor. The diagnosis revealed that Robert had a gynecological disease causing the itching. In his case, it was vulvitis, which resulted from an imbalance of vaginal flora, leading to the proliferation of harmful bacteria. The genital area is particularly sensitive, and itchy genitals are more common in women, often caused by conditions such as vaginitis, vulvitis, eczema, genital warts, and scabies. These conditions can cause significant discomfort and may be accompanied by other symptoms such as pain, burning sensations, and worsening during urination or defecation. Prompt medical attention is essential to diagnose and treat the underlying cause effectively. Another common area for persistent itching in the elderly is the lower legs. Itchy skin on the lower legs can be related to hypothyroidism. When thyroid hormone secretion decreases and the metabolic rate slows down, the skin becomes dehydrated and dry, leading to itching. The lower legs have the fewest sebaceous and sweat glands, making them more sensitive and prone to itching, especially in dry autumn and winter seasons. Dry itching indicates aging, while damp itching indicates illness. Dr. Wang, the deputy chief physician of the dermatology department of Wangjing Hospital, pointed out that different types of itching require different approaches. Dry itching, common in the elderly, is mainly manifested as dry and rough skin with peeling. As people age, the secretion of sweat and sebaceous glands decreases, and exposure to dry weather or dehydration can cause the skin to itch. Damp itching, on the other hand, is often related to diseases such as abnormal liver and kidney function, high blood sugar, and dampness in the perineum and anus. Liver and kidney dysfunction can lead to the accumulation of toxic substances in the body, resulting in poor skin condition, darkening of the skin, and itching. In addition to itching, these conditions can cause skin discoloration, roughness, swelling, and even secondary infections. While scratching is a direct and simple way to relieve itching, it does not address the underlying cause. Repeated scratching can damage the skin, resulting in redness, roughness, raised areas, and even secondary infections such as folliculitis and lymphangitis. These conditions can leave scars and further complicate the skin's health. Therefore, changes in daily behavior and lifestyle are necessary to alleviate itching effectively. To prevent dry skin itching, especially in the dry season of autumn and winter, it is essential to adopt a proactive approach. Pay attention to dietary regulation by reducing the intake of high-fat, high-sugar, spicy, and stimulating foods. Instead, consume more foods rich in manganese and vitamins, such as radishes, cabbage, sweet potatoes, animal liver, carrots, potatoes, and mushrooms. Proper skin care and adequate sleep are also crucial. While skin itching may seem like a minor inconvenience, it can be a significant indicator of underlying health issues, especially in the elderly. Persistent itching in specific areas, such as the armpits, anus, genitals, and lower legs, should not be ignored. Prompt medical attention and lifestyle changes can help diagnose and treat the root cause, ultimately improving health and longevity. Therefore, it is vital to be vigilant and seek medical advice if prolonged itching occurs. Your health and longevity depend on it. Research has shown that when lymphoma occurs, malignant lymphocytes produce biologically active substances like histamine. These substances are carried to the skin through the bloodstream, constantly stimulating the sensory nerve endings in the skin, causing itching. About 20% of lymphoma patients experience varying degrees of skin itching symptoms. Therefore, if unexplained itching persists and medications are ineffective, one should be alert to the possibility of lymphoma. In addition to itchy skin, lymphoma can also cause symptoms such as persistent lymph node enlargement, low-grade fever, night sweats, unexplained pain, weight loss, and anemia. It's important to pay attention to these symptoms. Itching is a common sensation that everyone experiences at some point. Typically, it's a minor annoyance that can be attributed to dry skin, insect bites, or allergies. However, when the itching is persistent and doesn't respond to usual treatments, it may indicate a more serious underlying condition. In the case of lymphoma, the itching is due to the malignant lymphocytes releasing histamine and other substances into the bloodstream, which then act on the skin's sensory nerve endings. What distinguishes lymphoma-related itching from regular itching is its persistence and resistance to standard treatments. Unlike common itching that may be relieved with moisturizers, antihistamines, or other medications, lymphoma-related itching remains stubbornly unaffected by these interventions. This type of itching is often described as intense and relentless, significantly impacting the patient's quality of life. Furthermore, the itching associated with lymphoma doesn't present with visible skin changes such as rashes or eczema. The skin typically appears normal, without the redness or bumps that usually accompany other types of itching. This lack of external symptoms can make it more challenging to diagnose and often leads to delays in seeking medical advice, as the individual may not realize the severity of their condition. Another characteristic of lymphoma-related itching is its sudden onset. It can appear without any preceding warning signs, catching the individual off guard. This sudden appearance is another red flag that differentiates it from the more gradual development of itching caused by less serious conditions. If such itching appears suddenly and persists, it warrants a prompt medical evaluation. Additionally, lymphoma-related itching is not significantly affected by weather changes. While many skin conditions may worsen or improve with changes in temperature or humidity, the itching caused by lymphoma remains constant. This persistent nature, regardless of external conditions, is another indicator that the itching may be due to a serious internal cause. If you experience persistent itching that does not respond to treatment, along with other symptoms such as lymph node enlargement, low-grade fever, night sweats, unexplained pain, weight loss, or anemia, it is crucial to seek medical attention. These symptoms, when present together, can point towards lymphoma, and early detection is key to effective treatment. Delays in diagnosis can lead to progression of the disease and reduced treatment options. Lymph node enlargement is one of the more visible and palpable symptoms of lymphoma. Lymph nodes may become swollen and firm, often in the neck, armpits, or groin. This swelling is usually painless, which is why it can go unnoticed or be disregarded. However, any persistent lymph node enlargement should be evaluated by a healthcare professional to rule out lymphoma or other serious conditions. Low-grade fever, another symptom of lymphoma, often goes unnoticed or is attributed to minor infections or illnesses. However, when a low-grade fever persists over a long period without an obvious cause, it should raise concern. This persistent fever is the body's response to the presence of malignant cells and requires medical evaluation. Night sweats are also common in lymphoma patients. These sweats are often drenching and can disrupt sleep, leaving the individual feeling exhausted. While night sweats can be associated with various conditions, when they occur along with other symptoms like itching and lymph node enlargement, they become significant indicators of lymphoma. Unexplained pain can also be a symptom of lymphoma. This pain may occur in the lymph nodes or other areas of the body and does not have a clear cause. If you experience persistent pain without an apparent reason, it's important to seek medical advice to determine the underlying cause. Weight loss and anemia are additional symptoms that can occur with lymphoma. Unexplained weight loss, especially when it is rapid and not due to changes in diet or exercise, can be a sign of a serious condition like lymphoma. Anemia, characterized by fatigue and weakness, can result from the body's inability to produce enough healthy red blood cells, often due to the presence of malignant cells in the bone marrow. Given the seriousness of lymphoma, it is vital to be vigilant about these symptoms. Early detection significantly improves the chances of successful treatment. If you notice any combination of these symptoms, particularly persistent itching that does not respond to standard treatments, seek medical advice promptly. While itching is a common and often benign symptom, persistent itching that resists treatment can be a sign of lymphoma. This type of itching is usually intense, appears suddenly, and is not accompanied by visible skin changes. Along with other symptoms such as lymph node enlargement, low-grade fever, night sweats, unexplained pain, weight loss, and anemia, it serves as a warning sign that should not be ignored. Early medical intervention is crucial for a better prognosis in lymphoma patients. Next, let's talk about persistent skin irritation, often brushed off as a minor inconvenience, can sometimes signal deeper health issues when it doesn't respond to standard treatments. Various underlying conditions might be responsible, particularly when the sensation occurs in specific areas without an apparent cause. This article delves into the importance of recognizing these signs, focusing on how localized skin irritation can indicate more serious health concerns. Discomfort in the armpits can be linked to diabetes. Elevated blood sugar levels can interfere with nerve function and the autonomic nervous system, resulting in decreased secretion of sweat and sebum, leading to dry, irritated skin. This condition is especially prevalent in obese diabetic patients who sweat excessively, creating an environment conducive to bacterial and fungal growth. The irritation tends to be seasonal, more severe in dry autumn and winter months, and usually lacks visible signs like red patches or papules. Instead, it manifests as a persistent hidden discomfort that can spread to other body parts. The sensation around the anus is often caused by various anal and rectal conditions. A significant percentage of individuals with these conditions, such as hemorrhoids, anal fistulas, rectal cancer, and anal cancer, experience this uncomfortable symptom. Initially, it may be mild and localized to one side of the anus but can intensify, spread, and become more regular if left untreated. This condition can be particularly bothersome at night, severely impacting daily life. For women, discomfort in the genital area is frequently associated with gynecological conditions. Diseases like vaginitis, vulvitis, eczema, genital warts, and scabies are common culprits. Vulvitis, for example, can lead to intense discomfort due to an imbalance in vaginal flora, promoting the growth of harmful bacteria or pathogens and disrupting the vaginal environment. This condition may also be accompanied by pain or a burning sensation, which worsens during urination or defecation and becomes more severe with scratching. Skin irritation on the lower legs may indicate hypothyroidism. Reduced thyroid hormone secretion and a slower metabolic rate can result in dehydrated, dry skin, leading to discomfort. The lower legs, with their sparse sebaceous and sweat glands, are particularly vulnerable to this condition. The irritation is usually most severe during the dry autumn and winter months and is characterized by tingling, dry, scaly skin, coldness, and paleness. Another area to watch is the scalp, where persistent discomfort can be linked to conditions such as psoriasis or seborrheic dermatitis. These conditions cause the scalp to become dry, flaky, and inflamed, leading to constant irritation. While dandruff is a common and less severe cause, persistent issues that don't respond to over-the-counter treatments may indicate a more serious underlying condition. The sensation on the palms and soles can be particularly distressing. This could be a sign of liver disease, where toxins that the liver would typically process and eliminate start to accumulate in the body, leading to irritation. This type of discomfort is often accompanied by other symptoms such as jaundice, fatigue, and unexplained bruising, indicating a need for medical evaluation. Similarly, persistent discomfort in the ears can be a sign of ear infections or more chronic conditions like eczema or psoriasis. This can cause significant discomfort and may also be accompanied by other symptoms such as discharge or hearing loss, necessitating professional medical assessment. Persistent irritation around the eyes can signal allergic reactions or dermatological conditions like eczema. This sensitive area can become inflamed and irritated due to allergens or irritants, leading to constant rubbing and scratching, which can exacerbate the condition and cause further complications. Discomfort on the back can be a sign of more serious underlying conditions like shingles, especially if it is accompanied by a painful rash. Shingles, caused by the reactivation of the varicella-zoster virus, requires prompt medical attention to manage symptoms and prevent complications. Localized irritation on the feet can indicate athlete's foot, a fungal infection that thrives in warm, moist environments. This condition can cause intense discomfort, peeling skin, and sometimes secondary bacterial infections, requiring antifungal treatment for resolution. For some individuals, persistent discomfort on the face, particularly around the mouth and nose, can be indicative of rosacea. This chronic skin condition causes redness, swelling, and discomfort, often triggered by environmental factors, and requires specific treatment to manage symptoms. Persistent discomfort on the hands, especially when it appears suddenly and without a clear cause, may be a sign of eczema or contact dermatitis. These conditions can cause intense discomfort, redness, and cracking of the skin, often necessitating medical treatment to control symptoms. Then, generalized discomfort that doesn't have a specific location but persists and doesn't respond to standard treatments may be indicative of a systemic condition like lymphoma or other forms of cancer. This type of discomfort is often accompanied by other symptoms such as fatigue, weight loss, and night sweats, requiring comprehensive medical evaluation for proper diagnosis and treatment. In general, while occasional skin irritation is common and usually harmless, persistent discomfort in specific areas without an apparent cause can be a sign of more serious health issues. It is crucial to pay attention to these signals and seek medical advice when standard treatments fail to provide relief. Early detection and treatment of underlying conditions can significantly improve health outcomes and quality of life. Alright, let's dive into this topic as if we were having a chat. You know, itching is one of those things that everyone experiences, but not all itching is the same. There's dry itching and damp itching, and each has its own story to tell. Itching is something we've all experienced. But did you know that the type of itch you have can tell you a lot about your health? Dr. Wang, who works at Wangjing Hospital, explained that itching can be divided into two main types, dry itching and damp itching. Each type points to different underlying causes, and understanding these can help us manage the discomfort more effectively. Let's talk about dry itching first. This is something that often happens as we get older. Picture the skin of an elderly person. It tends to be drier and maybe a bit flaky. This dryness can lead to that annoying itch. Our skin naturally produces oils and sweat, but as we age, these secretions decrease. So when the weather is dry or we don't drink enough water, our skin doesn't get the moisture it needs, resulting in dryness and itchiness. It's like when your lips get chapped in the winter, uncomfortable and sometimes painful. Now, what can we do about it? Well, keeping the skin moisturized is key. Think of using a good moisturizer as giving your skin a drink of water. It helps restore the natural barrier that keeps moisture in. Also, using a humidifier at home can make a big difference, especially in the winter when the air is particularly dry. And don't forget to stay hydrated by drinking plenty of water. All these little steps can add up to significant relief. On the flip side, damp itching is usually tied to health problems. For instance, if your liver or kidneys aren't working properly, it can lead to an accumulation of toxins in the body. This can manifest as skin issues, including itching. The skin might look darker, feel rough, and be prone to swelling. This type of itching can also occur in areas like the perineum and anus, often due to moisture and infections. High blood sugar is another culprit that can lead to damp itching. People with diabetes might notice their skin gets itchy more frequently. This is because high glucose levels can change the texture and condition of the skin. Managing blood sugar levels effectively is crucial, and it's something that should be done in collaboration with a healthcare provider. When damp itching affects areas with more moisture, like the perineum, it can be especially uncomfortable. This kind of itching is often due to infections or fungal growth, which thrive in damp conditions. Proper hygiene is crucial here. Keeping the area clean and dry, and sometimes using antifungal treatments, can help manage this type of itching. Now, let's dive deeper into how liver and kidney issues can cause damp itching. When these organs aren't functioning well, they can't detoxify the body efficiently. This means toxins that would normally be processed and eliminated build up in the system. The skin, being the largest organ, often shows signs of these internal issues. Besides itching, you might see discoloration, rough patches, and swelling. Sometimes, scratching these areas can lead to secondary infections like folliculitis or lymphangitis, which can be serious. Folliculitis is when the hair follicles get infected, usually from bacteria. This can cause red, painful bumps on the skin. It's not just itchy but can also be quite painful. Treating folliculitis often requires antibiotics and good skincare practices to prevent it from recurring. Lymphangitis is another possible complication, involving inflammation of the lymphatic channels. This can happen if bacteria enter the skin through scratches, causing red streaks, fever, and swollen lymph nodes. It's a clear signal that medical attention is needed, usually involving antibiotics to prevent the infection from spreading. So, how can we manage these different types of itching effectively? For dry itching, moisturizing regularly and using gentle skincare products are essential. Avoiding hot showers that strip away natural oils and using humidifiers can also help maintain skin hydration. And remember, hydration from within is just as important. Drinking plenty of water helps keep your skin in good shape. For damp itching, it's about addressing the root cause. If it's related to liver or kidney function, working with a healthcare provider to manage these conditions is crucial. Similarly, managing blood sugar levels can help reduce itching for people with diabetes. Proper hygiene and appropriate treatments are necessary for areas prone to moisture and infections. Lifestyle changes can also make a big difference. Wearing loose, breathable clothing helps prevent moisture buildup and skin irritation. Avoiding harsh soaps and choosing products that are gentle on the skin can prevent further dryness and irritation. Regular checkups with healthcare providers can help monitor and manage underlying conditions that contribute to itching. By addressing issues like liver or kidney dysfunction and high blood sugar, we can potentially reduce the severity of skin-related symptoms. Being proactive about health can make a significant difference in managing both dry and damp itching effectively. In summary, understanding the type of itching you're experiencing is the first step towards effective management. Dry itching is often a natural part of aging and can be managed with good skincare and hydration. Damp itching, on the other hand, usually points to underlying health issues and requires a more comprehensive approach. By paying attention to these signs and taking appropriate steps, we can alleviate discomfort and improve our overall skin health. Scratching is a natural, almost instinctive response to itching. It's the immediate gratifying action we take to get relief. However, while scratching might provide temporary solace, it doesn't address the root cause of itching. In fact, the more you scratch, the worse the situation can become. Persistent scratching can lead to a variety of skin issues. Your skin might turn red and become rough to the touch. You might notice it becoming raised or even damaged. Over time, these repeated actions can cause pigmentation changes, either darkening or lightening of the skin, bleeding, and in some cases, even secondary infections like folliculitis or lymphangitis. And unfortunately, these conditions can sometimes leave lasting scars. When it comes to managing itching, it's crucial to adopt a more holistic approach rather than just reacting with scratching. One effective strategy is making changes in your daily habits. This can significantly reduce the frequency and intensity of itching episodes. For instance, paying attention to your diet can make a big difference. Foods high in fat, sugar, or those that are spicy, stimulating, raw, or cold can exacerbate skin issues, so it's wise to limit these. Instead, opt for foods that are rich in manganese, like radishes, cabbage, and sweet potatoes. Manganese is known to play a role in skin health. Similarly, incorporating foods that are high in vitamins, such as animal liver, carrots, potatoes, and mushrooms, can help maintain healthy skin and potentially reduce itching. Dry itching is more prevalent in everyday life compared to damp itching, particularly during the autumn and winter months. The dry air of these seasons can wreak havoc on your skin, leaving it parched and prone to itching. While this is often associated with older adults, younger individuals who neglect proper skincare can also find themselves suffering from itchy, dry skin. So, prevention becomes essential. One of the simplest preventive measures is to ensure you're getting enough sleep. Adequate rest can significantly improve your skin's health and resilience. Additionally, it's essential to avoid scratching as much as possible. While it might seem difficult, finding alternative ways to soothe the skin, such as using cold compresses or gently tapping the area, can be beneficial. Washing your face with cold water can also help to keep your skin hydrated. However, this should be balanced with the need to keep your skin clean and free from irritants. Reducing the frequency of baths during the autumn and winter months can also help, as frequent bathing can strip the skin of its natural oils, leading to dryness and itching. When you do bathe, using a moisturizing lotion immediately afterward can lock in moisture and keep your skin supple. Another key aspect of managing and preventing itching is to change any unhealthy aspects of your living environment. This might include things like adjusting the humidity levels in your home, ensuring you're not exposing your skin to irritants, and maintaining a clean living space. It's also important to identify any specific triggers that cause your itching. This could be anything from certain fabrics, soaps, or even stress. Once you've identified these triggers, you can take steps to avoid them, which can greatly reduce your itching episodes. Dietary regulation can't be overstated when it comes to skin health. Reducing the intake of high-fat and high-sugar foods is crucial. These foods can contribute to inflammation in the body, which in turn can exacerbate skin issues. Spicy and stimulating foods can also cause flare-ups for some people, so it's worth monitoring your diet to see if these foods are affecting your skin. On the flip side, focusing on foods rich in vitamins and minerals can promote better skin health. For example, foods high in vitamin A, like carrots and sweet potatoes, are known to support skin health. Similarly, vitamin C, found in citrus fruits and strawberries, can help with collagen production, which is essential for maintaining skin elasticity and preventing dryness. Additionally, maintaining a regular skincare routine can make a significant difference. This doesn't have to be complicated. Simple steps like washing your face with cold water, using a gentle cleanser, and applying a good moisturizer can go a long way. It's also important to protect your skin from harsh environmental factors. During the winter, this might mean using a humidifier to keep the air in your home from becoming too dry. In the summer, it means protecting your skin from sun damage by using sunscreen and wearing protective clothing. It's also crucial to address any underlying health issues that might be contributing to your itching. Conditions like eczema or psoriasis require specific treatments and management strategies. If you're unsure what's causing your itching, it's a good idea to consult with a dermatologist. They can provide a proper diagnosis and recommend an appropriate treatment plan. Managing stress is another important factor. Stress can have a significant impact on your skin, potentially exacerbating itching and other skin conditions. Finding healthy ways to cope with stress, such as through exercise, meditation, or hobbies, can have a positive effect on your overall skin health. Finally, it's important to listen to your body and respond to its needs. If you notice that your skin is becoming dry or irritated, take steps to address it immediately. This might mean applying a moisturizer more frequently, adjusting your diet, or making changes to your skincare routine. By being proactive and attentive to your skin's needs, you can significantly reduce itching and maintain healthier skin. In general, although skin itching is not a disease but a symptom, it can reflect the skin condition and overall health status of the body. Persistent itching may indicate underlying health issues that require attention. For example, conditions like eczema, psoriasis, and allergic reactions often present with itching as a primary symptom. Moreover, systemic diseases such as liver disease, kidney failure, and certain cancers can manifest through prolonged skin itching, making it essential to recognize and address the symptoms seriously. Ignoring persistent itching can lead to more severe health problems. Scratching the itch can cause skin damage, infections, and scarring, exacerbating the underlying issue. Additionally, the constant discomfort can affect one's quality of life, leading to sleep disturbances, anxiety, and depression. Understanding the potential causes of skin itching and taking appropriate measures can prevent these complications and promote overall well-being. Therefore, when prolonged itching occurs, it is crucial to be vigilant and seek medical attention promptly. Early diagnosis can make a significant difference in treatment outcomes. A healthcare professional can help identify the root cause of the itching and recommend appropriate treatments, whether they involve topical medications, lifestyle changes, or further diagnostic tests. Addressing skin itching at its onset can lead to more effective management and relief. That's all for this video. Thank you for watching and participating. If you found this content helpful, please give it a thumbs up, subscribe to our channel, or share it with your friends by clicking the button in the bottom right corner. Your support is my greatest motivation. See you in the next video.